Okay, Fabry disease and stroke. This is actually going to be our first time we're going to be talking about lysosomal storage diseases, although it won't be the last time. So lysosomes are intercellular organelles that are involved in breaking down whatever we're done with, whether it be nucleic acids, proteins, fats, and we bring whatever we're done with. Our cells are much greener than we are, so we bring whatever we're done with into the lysosomes to be broken down into smaller components so that then they can be extruded from the cell and be recycled, actually. Each lysosomal enzyme reduces a particular macromolecule to a smaller component. As I said, these smaller pieces can then be eliminated from the body. The problem is defects in any of the enzymes, whether it be to break down proteins or nucleic acids or lipids. If one of them's not working, that particular chemical gets into the lysosomes but doesn't get out. And that is what's known as a lysosomal storage disorder. And as a result, these byproducts accumulate within the cell. Fabry's disease is just one of these disorders that we're going to be talking about today, and we're going to be talking about some other ones later. So lysosomal storage diseases, here's just a nice little diagram, and I will show you this diagram again next year when we get to talk about some of these other disorders. But in Fabry's disease, the problem is this chemical ceramide trihexide cannot be converted to glucocerebride through this enzyme GLA, or alpha galactosidase A. So this is the enzyme that's defective. So what happens when that occurs? Well, here again we have our lysosome here. And if this enzyme is not working correctly, if the GLA is not working correctly, this glycolipid accumulates inside the lysosome. And the lysosome becomes so large, it kind of takes over the cell. And the cell becomes so large, it starts obstructing small vessels, capillaries. Where do we have our smallest capillaries? The kidney, the heart, and the brain. And so the kidney, especially in males, results in renal failure. Cardiomyopathy is common in both males and females because of this. We're going to talk about males and females in a second. And the ongoing obstruction of these small capillaries in the brain eventually results in stroke. So here's a family history of a typical picture. A mother had an MI. Here's this 12-year-old that comes in to clinic. He has tingling in his hands and feet, and the family history indicates his mother is 46, but she had an MI at 47. She has a sister who had an MI at died from an MI at 45, but also had a stroke at 42. And a sister who is 53 and had a stroke at 44. This child's maternal grandmother died at 58 of an MI, and her brother died of renal failure at 39. So that's the X-linked history of Fabry's disease. So the gene for Fabry's disease is located on the X chromosome. Clinical features of Fabry's disease often occur, it actually starts early in childhood, but often is not diagnosed till adolescence, especially in males. Early symptoms include the inability to sweat because the sweat glands have very small capillaries as well. Another early symptom is tingling in the hands and feet and pain, which is known as acroparesthesias. And then this non-blanching rash. This is actually something called whorl keratopathy, which is another sign of Fabry's disease. And clinical features include renal failure, strokes, cardiovascular disease. As I was showing you in the original pedigree, this is inherited on the X chromosome, and we used to consider this X-linked recessive, but we've since realized females, the X chromosome, the genes on the X chromosome are unique. And I've talked about this before, but the autosomes, you have two copies of your genes. One you get from your mom and one you get from your dad, and they're both, in most cases, although next year we'll talk about the imprinted genes that aren't, in most cases, they're both active. So most enzymes that are deficient in a patient, going back to when we talk from the inborn errors of metabolism, as long as you have like 20% enzyme activity, you'll be fine. So if it was an enzyme, you could say, if it's an enzyme, it's probably autosomal recessive, because if one copy's not working, but that's not as true on the X chromosome. So on the X chromosome, either when mom has, if the man has one copy of the X chromosome and the gene GLA is not working, then he doesn't have any enzyme. A female, however, has two copies, but in individual cells, only one is active because of X inactivation. So either her mom's copy is active or her dad's copy is active, and depending on which parent gave the non-functional copy of the gene, half of her cells don't have functional enzyme. Now, what does that mean for the heart? Well, there's little pockets in the heart that have genes that aren't active, because this X inactivation occurs very early in embryogenesis, and once that particular X is turned off, it cannot be turned on. So there's pockets of cells that this big pocket of cells does not make this enzyme. Therefore, there's accumulation. Therefore, there's obstruction of small capillaries. So in the heart, this results in small ischemic events, which results in cardiomyopathy, which is a really common complication of females. And in males, and in the brain, it can result in small strokes. So, as I was saying, the deficiency of the alpha-galactosidase A, or GLA, results in deposits of these glycoproteins in vascular endothelium. As I was showing you earlier, the cells get so large they obstruct the vascular endothelial, and the smooth muscle of the blood vessels become narrow, and ischemia occurs. And again, the smallest capillaries are in the kidney, heart, and the brain, as well as the sweat glands. So cardiac complications, and I know this is about the brain, but this is where I'm presenting Fabry's. Again, it's one of the most common complications, and it results in left ventricular hypertrophy and mitral valve prolapse. But here's a normal heart, and you can see how enlarged it is. Cerebral vascular disease is also very common, and that's why I'm presenting it here. Clinical symptoms range early from transient ischemic attacks, basilar artery ischemias, aneurysms, cerebral hemorrhage, and stroke. So, as these things are accumulating, and they, quite frankly, they accumulate over a lifetime, early symptoms of Fabry's disease in the brain include migraines and maybe blood vessel abnormalities. As things get a little bit worse and we're obstructing more and more small capillaries, we start seeing MRI abnormalities, and then the transient ischemic attacks. So transient ischemic attacks are obstructions, ischemia events, but then they get better because the brain can, repair itself. But as we have more and more of these glycolipids accumulating in the brain, we start having memory problems like dementia, and then finally strokes. As I've said a few times, women with one copy of the gene for alpha-galactosidase that is non-functional can have symptoms that range from as severe as males to milder symptoms, and it really kind of depends on X inactivation. Although I know very few females. I manage about 60 lysosomal Fabry patients here at Rush, and I know very few females who have no symptoms. Renal failure occurs later than males, and the reason for that is you actually only need a quarter of one kidney to have normal kidney function. So if you're obstructing an ischemic part of your left kidney and part of your right kidney, you add it all together, and females usually maintain kidney function. Males, on the other hand, start showing signs of severe renal disease, usually by late teen to early 20s. But the thing about the female is, again, we're talking about families. They are not a good candidate for a kidney transplant for their brother or their father or anybody else in their family. If they are a carrier for one copy of this gene, A, they need both of their kidneys, and B, it's not going to be all that much help to that person because it's really only kind of half or less functioning. As I said, stroke is a common complication because of this chronic ischemia of these small capillaries, hypertrophic cardiomyopathy. And here's this thing called whorl keratopathy. It's actually seen more in females. It's seen by the ophthalmologist. It's just a sign of Fabry's disease. Males and females are at risk of cataracts, which is actually an ophthalmologic complication, but these don't really cause issues. So the main problem in Fabry's disease is the accumulation of these glycolipid lysosomal byproducts in the cell. And this includes microvasculature in the kidney, heart, and the brain. This occlusion results in death of tissues because of ischemia. And progressive neurologic disease is a common complication. However, cardiovascular disease is the most common cause of death in both males and females. Now, unlike almost everything else that you've been learning about, there's actually a treatment for Fabry's. Now, for the pain in the hands and feet, they sometimes give gabapentin, but Fabrazyme is an IV enzyme that can be given to patients to add that enzyme that they have deficient. And this is shown to slow the progression of renal disease and cardiovascular symptoms. Unfortunately, because this enzyme does not cross the blood-brain barrier, the risk of neurologic complications continues. They are working on some new therapies, and hopefully over time we'll have better options as far as management for the neurologic symptoms. So that ends this lecture. If I can figure out how to turn it off.